One of the Maldives' legendary footballer has suffered from meningococcal infection and has died 2 days ago after returning from Hajj. So at this time it became imperative that I should make an awareness video about what meningococcal infection is, how it spreads, which group of people are at highest risk of being infected with that deadly infection. We need to know who should be more cautious about this disease. One thing you should be clear about is that all the people who have returned from the Hajj and their families and their contacts, they should be most cautious about this deadly disease. Specifically, those people who were unvaccinated before going to Hajj, they should be more cautious about this disease, as they are at the highest risk of getting this disease. This is a bacterial disease that would affect your brain, spinal cord, and in the brain and spinal cord, especially the protective layers that are protecting your brain and spinal cord, this deadly bacteria would infect those meninges. So what are the symptoms of this disease? The first and foremost symptom is fever. Any person who is having high grade fever along with the vomiting, and then another important symptom, neck stiffness. If a person is having the neck stiffness, fever, vomiting, and altered mental status means that if a person is feeling drowsy, if he is feeling unconscious, if he is behaving in an abnormal manner, then these persons should specifically and immediately consult a doctor, because there are higher chances that these persons are having this infection. So the next important matter is how this deadly infection spread. You should know that this infection spread by respiratory droplets. Respiratory droplets means that if a person is coughing and along with his cough there would be micro droplets, and if another person is in the vicinity of those droplets, then that infection could transfer from that person to the other person. So it would not transfer from one person to a person who is standing in that distant place. And the other methods by which it can transfer is through the utensils. Like if an infected person has used any utensil, so definitely that utensil he has touched with his mouth, and respiratory droplet has transferred to that utensil. And then when another person would use that specific utensil, those respiratory droplets would transfer to the throat of that healthy person. So through this method also that healthy person could be infected. In addition to this, through kissing and other body droplets, this infection could also transfer from one person to another person. So you should be more careful these days about using the utensils whenever you are going out, whenever you are dining out, whenever you are having dinner at some lavish place. So you should be careful about these things. So the most important aspect is this disease curable. Yes, this disease is totally curable and totally preventable. If any person is having these kind of symptoms which I have just explained, that person should immediately consult a doctor. Your doctor would do some investigations, and on the investigations, if he finds out that you are having this deadly infection, he would immediately start the antibiotic treatment. Remember, the time is the main thing in treating this deadly infection. If you are having this deadly infection and you are reaching in the hospital on time, then there are high chances that you would get completely recovered from this infection. So in these tumultuous times, it is imperative that we should spread this information. So share this video as much as you can to raise the awareness.